The World Health Organization 2003 report indicates that over 85% of adults in the United States have gum disease. Most don't even realize it. In the beginning, the symptoms can be slight, a little bleeding when you brush your teeth or puffy gums. But if not dealt with in the early stages, periodontal disease can lead to receding gums, lost teeth, and chronic bad breath. Studies have also discovered an association between infected gums and heart, lung, and circulation conditions.
Nobody had ever told me that I had a gum disease. I knew I had receding gums, but I had not been told that I had a gum disease.
The biggest problem I had was with my gums bleeding. When I would brush them, they would bleed, off and on, but I knew it wasn't something that should be going on with my teeth. And I always had problems with tartar.
And I noticed then all of a sudden my gums starting to recede.
And my mouth didn't feel real clean, so I thought, well, maybe there's some gum disease going on that I don't really know about.
So what exactly is gum or periodontal disease? How does it develop, and what can you do about it? Between your teeth and your gums is a small valley called the sulcus. It's only 1 to 3 millimeters deep. Brushing and flossing usually keep this area clean and healthy. There are special cells in the sulcus that form a fluid like saliva that flows out of the pocket. This is called crevicular flow and helps keep the area clean too. If food, plaque, or tartar build up in this area, the gums become infected. They will appear puffy and become tender. This early infection is also called gingivitis and can progress to periodontitis. Unfortunately, most people will decide it is too painful to brush or floss the swollen gums, and this just lets the infection continue. As the infection worsens, the gums become even more inflamed, and the infection involves the bones supporting the teeth, and the teeth become less stable. The infection increases, and the ultimate result is the loss of bone, teeth, and gums. Once infected, what can you do?
I've been seeing a dentist every 6 months for as long as I can remember. Taking care of my teeth, brushing every day, twice a day, flossing my teeth, thought I was doing all the right things. Knew that my gums were bleeding, but wasn't too worried about it. I thought flossing will take care of that. But when I went to see him and he runs all the tests on you and shows you all the calibrations, then I definitely had periodontal disease.
Even with the brushing and flossing, those pockets that the gum disease causes, you can't get all the way in and get those the food and stuff out of those pockets.
I had good dental hygiene and did not expect to have gingivitis, but I did.
Certainly, brushing and flossing continue to be important, but if you have periodontal disease, you will need professional treatment from your dentist. Dentists have many options when treating your gum disease. The standard cleaning procedures called scaling and root planing can help to remove plaque and tartar and reduce some of the bacteria involved. Often the disease is extensive enough that this is only a partial solution. Surgery is another option. The diseased tissue is cut away, then sutures and a surgical dressing are used. This can be quite painful and costly, since only portions of the mouth can be done at any one time. Unfortunately, if the home care is not changed, the disease returns, and often the patient must repeat the process years later.
The surgery is so arduous. It's not just an appointment and you're done. It's 4 appointments, and you have the surgery, you have sutures, you have to go back a week later and have the sutures removed, you have a recovery process, and then you do it 3 more times. And that's very difficult.
Then there was limitations as to what you could eat and drink for several days, and there was some pain involved.
It's a very expensive process, too.
Since the condition is an infection, many dentists have attempted to place antibacterial medications in the sulcus to help kill the pathogens. But remember the crevicular flow? That fluid flushes out the pocket almost 40 times every hour, meaning the medicine gets washed away almost immediately. With an increased infection, the fluid flow increases, sometimes as much as 30 times. It is impossible to maintain a high enough concentration of the medication to kill the bacteria, as the medications are constantly flushed out of the sulcus. To work around this, dentists developed fiber strips or small plastic chips that could be left in the sulcus with time-released medicine. While helping to keep the medicine in place for a slightly more extended time period, this still required the patient to return to the dentist every few days for reapplication of the medicine. Not a very practical solution. In response to all these obstacles, a new option has been developed, the Perio Protect method. Using custom-formed trays, antibacterial medication is directed to the source of the infection. The seals in the tray hold the medication in the sulcus long enough to kill the bacteria and control the infection. Your dentist will prescribe the best medication for your situation, and by wearing the trays for minutes each day, your infection can be controlled. The Perio Protect method overcomes previous obstacles, is easy and painless, and is a very effective option.
I could do it at home. I didn't have to have an appointment to go see anyone, that it was up to me to actually make sure that I got the process done in the way that it was described. And I found that very attractive. That was something that I could control and that I could do.
The trays are no problem to put in or take out.
You just wear them doing whatever you want to do.
It is easy, and it works.
While a serious medical condition, your periodontal disease does not have to diminish your quality of life. Now that you understand what is going on in your mouth and some of the options you have, you can take control and put yourself back on the road to a healthy smile. Please don't hesitate to ask your dentist or other medical staff about anything you have heard here, and let them help you in conquering periodontal disease.
It's painless, it works.
I don't have to worry about my gums bleeding anymore. I don't have to worry about pain in my teeth anymore.
The end results are just great, so why wouldn't you want to do it?
I am really glad that I discovered these trays.